you don't know what you're doing, don't do it. Send them to someone who does. Don't guess. Follow the science. Follow the evidence. Follow the evidence-based practices. Every primary care physician should understand how to manage metabolic issues. If we see weight as a metabolic issue as no different than diabetes, there should be no confusion as to how to treat it.
Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here. Well, hello. Hi, everyone. Welcome to another episode of the Care Room with Dr. Cindy. I am so excited about my guest today. It's Dr. Toomer. She's joining us all the way from South Carolina, and she is the founder and CEO of Total Weight Loss Clinic. Did I get that right, Dr. Toomer?
Total Weight Care Institute.
Total Weight Care Institute in South Carolina. Before I mess things up any further, guys, I'm going to let her introduce herself.
All right. Yes, I am Dr. Catherine Toomer. I'm a family medicine community health physician and the founder of Total Weight Care Institute, which is actually an umbrella organization that includes my total weight care programs for patients and my profitable weight care practices for physicians. So that is what I do. So I have courses for both. I coach both, and I've been doing this now for over 15 years.
Oh my goodness, Dr. Toomer, we appreciate you being here, and we're so excited to learn from you today. I know that, I've heard a lot of podcasts that you've been on, listened to your story, and I've just been so inspired. And I was wondering if you could share some of that with us today. Like, how did you get started with weight loss?
Well, really what I do, people tend to come to me for weight loss, but really what I do is metabolic correction. And when you correct metabolic, when you go after people's metabolic dysregulation, it results in weight loss. And so that's kind of how I got known for weight loss, because I've been so successful at it. But essentially, the way I started was on myself. I have a strong family history of diabetes. I have a strong family history of metabolic issues, and stress is one of those things that can amplify that. And when metabolic issues get amplified, weight gain starts. And so through college, through med school, through marriage, through having babies, all those things that can cause metabolic dysregulation, I found myself, I had class 3 obesity. I was an insulin-dependent diabetic, and then went into congestive heart failure with my last pregnancy.
I'm sorry.
And as a result of that, and trying to get help, no one would help me. Everyone just said, focus on your heart. You have a 50% chance of living 5 years. Focus on that. But I knew that unless I reduced the harm to my heart, which was my obesity and my metabolic status, that I wouldn't be able to survive those 5 years. And so rather than waiting for someone to help me, I created my own program.
Wow.
Which was very successful. I was able to get off insulin within 6 months. My weight had dropped by about 60 pounds at that point. And then when I was well enough to go back into practice, I took my program and started using it with my patients and was successful with them. But I was a community medicine physician. I was working for other people. I was in community health centers, and you get 15, 20 minutes at most with a patient.
Yep.
And when you have real transformation, you need more than 20 minutes. So I left and started my own practice.
Okay. When was that? What year was that?
I left the clinics in 2016.
Okay. Wow, that's awesome and amazing. I can only imagine the mindset shift that had to happen to do that in 6 months. That's amazing. Can you tell us more about the mindset, we like to say drama and
Mhm.
thoughts and the shifting that had to occur to help you do that? I know
Well,
there are
what
a lot of patients that we have listening.
Well, one
Probably
of the things I did, I went back to my education. My education is very much rooted in the biopsychosocial or holistic approach to medicine. And
okay.
so I already knew the biology. I went back and I studied more of the biology to understand, it's like to unmake something, you need to know how it's made.
Right,
And so I
right.
went back to the basics to find out, the microbiology, the biochemistry, all the molecular biology, all of it, cellular biology, to really understand, what is metabolic health, what contributes, how do you reverse any damage that's been done. But the biggest shift was psychological in that I had cardiac depression. Most people know that when you have a cardiac diagnosis, depression sort of follows. Our heart and mind are connected. Postpartum depression. I already had low level chronic depression. And so, in all the combination, and one of the things that happens with depression is that your self esteem suffers. You feel worthless. You feel useless. You have no motivation. You're tired all the time. On top of my cardiac disease making me tired all the time, having a newborn and a toddler.
My gosh.
So, I realized I had to treat my depression first. In order
Yeah.
to have the motivation to do all the other things, I had to focus on my depression first. And so I started there.
Okay.
And it just so happened the medication I used is also one that's used in weight management.
Okay. Wellbutrin?
Yes, which was
Yeah, okay.
Wellbutrin.
Yeah, okay.
It's a very quick acting antidepressant. I already knew from practice. I
Right.
used it a lot with patients. I knew it was very quick acting. I knew it wasn't addictive. I knew all the contraindications, which is basically having a seizure disorder. And which I didn't have. And
Right.
so I started using it and immediately felt the difference and started working.
Sure.
I was also very fortunate that my husband is a physician and he also took over a lot.
Aw.
He had to
Yeah.
because, I couldn't stand up and brush my teeth. So I definitely couldn't cook and run behind children and wash them. And
Right.
I could barely wash myself. So,
Right.
I was really debilitated. And so having that to focus on was very, very helpful.
Sure, sure, sure. So you tackle the mindset
Hmm.
and your mood
Yes.
first. You use your kind of background knowledge, medical
Hmm.
knowledge, to help. Can you speak to the patient who's listening and they're like, "Wow, she had help in the sense of a husband. She had help with her medical knowledge, but I am here struggling.
Hmm.
I'm in the same spot. I'm depressed." Are there like resources that you would suggest people? I know as PCPs, we recommend
Hmm.
a lot, but any weight loss, like therapies that help as well?
Well, one of the reasons why I started my YouTube channel was for that reason, was to get good information out there. And so I have a YouTube channel with over 300 videos and shorts for people to look at and find out. And any topic that's not there that people want to know about, they can write to me at help@drtoomer.com and I am happy to do another video
Yes,
and add
guys,
to
you
it.
heard it. You heard it. She's your resource, and she's someone who's been there, done it herself, and can certainly help.
Hmm.
Thank you so much for that, Dr. Toomer. So, can you tell us more about the actual regimen that you use? I know it's part of your practice.
Hmm.
So, what can patients expect when they work with you?
Well, what patients expect to work with me is for me to see them and hear them. I listen more than I talk.
Okay.
There's a lot of things that we have put up with, a lot of things we've internalized over the years that we don't even realize we've internalized. And so I listen for those things. I listen for people, and we tend to self blame a lot. I hear a
Yeah.
lot about all the exercise that, people did or didn't do. I listen to a lot about the food that they did or didn't eat. When really the most important thing for me is their metabolic status, which has very little to do let me say this. I listen to those things, I hear them, but I know what they really mean. So when people say, I can't stop eating carbs, every time I get stressed, I stress eat. Every time I do, I know that that's a metabolic shift. They're thinking it's somehow their willpower that's been affected. But I
Right.
know that our willpower is not really us.
Right. It's
It's our
something.
brain playing tricks on us.
Yeah. Yeah. So there's something
Yeah.
behind it. Okay.
Exactly. There's always a metabolic reason behind it. People think that our behavior affects our health when it's the other way around. It's our health that affects our behavior. And yeah,
Interesting.
and people just haven't been told that and taught that because mainly because of medical bias.
Yeah, yeah.
That's
So
really
do
it.
you recommend any tests that they do, like, when they come to see you?
It depends on whether you know what they've had done before, but I always check for diabetes first. I check to make sure kidney and liver functions
Okay,
are good.
okay.
If able, I'd like to do a glucose tolerance test because often what happens is people have a problem with glucose regulation for about 10 years before it shows up in their labs unless they're challenged.
Yeah,
And so I do a challenge to see what their body does on a normal day in normal situation when they're challenged with sugar because that's where the problem lies.
got it.
And usually what happens is I find it either in high blood sugar or in high insulin levels. And the way our body makes fat is it takes blood sugar and it drives up our insulin. And then our insulin tells our body, take these calories and make fat out of them. Don't make fuel. Don't give it to the muscle, give it
Right.
to the fat cells.
Yeah.
That is a genetic, we're genetically predisposed for that.
Yeah.
And so I look for that. So when people say, "Oh, I've been overweight my whole life," or "Everybody in my family is overweight," that tells me right there, there's a genetic component going on, and therefore that has to be addressed. One of the things we hear a lot is when people who are very, very thin, who can eat whatever they want, and they don't gain a pound, we say, "Oh my gosh, they have good genes." Well, it's the same for the opposite. Not saying anyone has bad genes, but
Right.
people understand the genetic component for that, but they don't see the genetic component for the other side.
Got it. Got it. Do you recommend any medications? I know we talked about the Wellbutrin,
Mhm,
but what are your thoughts on, like, the injectable meds that are
mhm.
the rave right now?
Okay. One of the big things that I have a problem with is people calling them weight loss meds. They are not.
Okay.
They're actually metabolic correctors. They're correcting the reason that people gain weight in the first place. They cannot be effective unless they're treating something. So I often say, if you don't have a headache and you take Tylenol for a headache that you don't have, what does it do? Nothing. It's the same with these medications. They only work because they're actually treating a metabolic condition that nobody told patients they actually had,
I see
that
your
they've
okay.
never checked for it. They didn't know they had it. Many physicians never learned that it is a metabolic issue. And so, the only reason metabolic correctors, diabetes medications work is because fat production starts here in insulin resistance. Diabetes is up here, but before you
Mhm.
get from here to here, you have 10 years of weight gain.
Yeah.
And
Yeah.
these medications stop that and
Yeah.
reverse it.
Yeah. And so do you use that in your practice
Mhm.
for patients? Yeah. Okay.
I've been using it for 15 years.
For 15 years. Okay.
I started using GLP-1s for weight management before it was FDA indicated for weight management. I
Wow.
used it off label.
Okay. Yeah. A lot of us do that.
Mhm.
Okay.
Yeah.
Okay. And for our patients who are really struggling in that perimenopausal, menopausal period of life, do
Mhm.
you have any recommendations concerning weight loss for them?
Prevention is better than a cure. So, when one of the things that we talk about perimenopause and menopause, everyone thinks hormones. And yes, our hormones start changing. In perimenopause, our hormones fluctuate, so testing is useless. And then in postmenopause or menopause and postmenopause, there's no point. You already know you're in menopause because your period stopped. So what's the point? You need to replace it. But what happens, we talk a lot about the hormones of menopause, but the problems that we have with perimenopause and menopause are actually caused by the metabolic control that we've lost because those hormones are low. Our hormones help protect us from metabolic dysregulation. So when the hormones drop, that metabolic dysregulation suddenly goes rampant and it shows up as middle weight gain. And so the best way to prevent that middle weight gain and to prevent the metabolic issues it represents, which is heart disease, dementia, kidney disease, and others, is to prevent it by taking hormone replacement and possibly a low dose GLP-1 as
Okay.
well. We'll put it this way, hormones will prevent it from getting worse, but
Right.
it won't reverse it. GLP-1s will actually reverse it
Okay.
if it's
Even
already
that
there.
stubborn belly fat? Yes. Okay. Yes.
But the
Okay.
other thing that does that is muscle.
Yeah.
Because there's two things that cause it. Well, see, the issue is the metabolic dysregulation that causes middle gain is caused by lots of different reasons. Menopause is one, pregnancy is another, stress, chronic stress is another, genetics, when they hit our genetics, polycystic ovary syndrome is another. And so all of those things can cause this, and you have to make sure that all of them are addressed. And the best way to address them is by making sure your hormone levels are where they're supposed to be, making sure that everything that you have is being treated and corrected, making sure that your stress levels are down. Cortisol regulation, cortisol correction is probably one of the one areas everyone just overlooks because it's not tested for. We already know it's there. And so you just do what's necessary to bring your cortisol levels down. And then the other is muscle.
Yeah.
Muscle
You,
is our metabolic powerhouse.
yeah. You recommend the strength training and yes. Okay. Okay. All right. So this is awesome. I'm learning so much. Even as if you're talking to us primary care doctors,
Mhm,
we're the first stop for a lot of patients. They come to us, doc,
mhm.
I really need those GLPs. I need help losing weight. What recommendations? What would you be, if you had a chance to talk to a room full of us, what would you, yeah,
First thing I'd say is check your bias.
I like that, Dr.
Make
Toomer.
sure you understand what your attitude about weight is.
Okay.
Understand what your attitude about treating weight is. Because a lot of times patients get opinions, they
Mm,
don't get scientific facts. And so it's really important to check your bias and don't spread misinformation to patients simply because of your own personal attitudes about something.
okay.
So that's number one. Number two, if you don't know what you're doing, don't do it. Send them to someone who does. Don't guess. Follow the science. Follow the evidence-based
Okay.
practices.
So do you recommend everyone should be obesity med certified?
No,
Or
I'm not even obesity med certified. And I think what that is a money grab.
you do?
Honestly, every family medicine, every primary care physician should understand how to manage metabolic issues. If we see weight as a metabolic issue, as no different than diabetes, there should be no confusion as to how to treat it.
Right.
The only problem is we see it as something separate. And so therefore everyone's like, I don't know what to do. Yes, well, then what do you do for your diabetics? It's exactly the same. There is absolutely no difference in treating obesity than treating diabetes because they are on the same continuum.
Yeah. It is a continuum.
Yeah.
Yeah,
And
absolutely.
so there's no difference.
Yeah.
And that's what I tell people. And they have to believe it. And if they don't believe it, then study it enough so that you do believe it and understand it.
Yeah. Yeah. Thank you. Thank you for that. So, can you share with us your socials and how we can find you
All
and
right.
yeah.
drtoomer.com. That's drtoomer.com
Okay.
everywhere. That's my .com is my website. Dr.
Okay.
Toomer on YouTube, Dr. Toomer on Facebook. The only place I'm not Dr. Toomer is Dr. Toomer Talks on TikTok because there is already a Dr. Toomer. And and you can find me every Tuesday. Every Tuesday I do a live show that streams into Facebook and Facebook YouTube, both
Okay.
on my platform and blackdoctor.org. So
Okay.
you can find me in either place. And I do every Tuesday followed by a Q&A. And the
Sure.
Q&A does not have to be related to the topic I'm talking about. Most people just ask me questions about everything. A lot of menopause questions, a lot of weight management questions, but also, uh, um, I trained at a time and in a space where the whole person is treated and where you treat the person, not their labs, where you use all tools at your disposal, including some of the, more non-conventional ones. And I love sharing that information. So if anyone asks me questions, I'm ready. And if I don't know, I'll say I don't know because
Absolutely.
that's important.
Absolutely. Yeah. Yeah. I love that you mentioned treating the whole person because I think
Mhm.
we're moving away from that with
Mhm.
corporate medicine. Like you mentioned, 20-minute visits, 30 a day. There's no way that you can treat the
Mhm.
whole person. So I'm glad that you're offering a space and an option where that can happen for patients. So thank you for
Yes.
all you do. Yeah.
Yeah. Well,
Thank you
I'm
for
actually creating a bigger space where I'm creating a community where people can just come and get information about their hormones, talk about their hobbies. They can talk about whatever, their homes, whatever it is, so that we just have a place we can relax and get information and just ask questions without any judgment and just find what you need. And then if it's not there, then I know what people need and I can get it and put it in there.
Yeah, where is this space, Dr. Toomer? Tell us
Well,
more.
you have to watch my spaces. I'm actually in the process of developing it right now. It's called
Okay.
Alive in Harmony,
Okay.
mainly because my maiden name is Harmon. So it's Alive in Harmony. And essentially what it is just a space for people just to find their center. And
Right.
in doing so, improve their health, getting real information. So they know it's like if I come in there and I see it, I know that it's not misinformation. Can be a good place as long as you don't listen to the people who really are not medically trained. There are a lot of people on TikTok who sound really, really good and have no clue what they're talking about because they've learned to speak based on their own profession, which is sort of a paramedical
Sure.
profession, but they're talking about real scientific things that and inaccurately. And so I wanted to create a space where there's no guessing.
Thank you. Thank you, thank you, thank you. We certainly need it. So,
So
absolutely. Thank you for that. All right, guys. This was a wonderful episode. I want to thank Dr. Toomer for being with us and sharing her story. I hope it inspires and you guys got something from it. But again, if I'll put her contact info in the show notes. So if you want to check her out, certainly do that. Dr. Toomer, thank you again for being with us.
thank you for having me. All
Absolutely.
right.
Until next time,
Bye.
guys. Take care. Thanks for spending time in the care room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, treatment, or diagnosis. Always, always consult your personalized healthcare provider for medical guidance.